in Article 1, they talked about cystic fibrosis and the technology that is being developed and used to help treat it. So, first off, cystic fibrosis, or CF, is the most common fetal genetic condition amongst Europeans, and it currently affects over 10,000 people in the United Kingdom. It is characterized by the inability to clear one's mucus in the lungs and like the airways, which can cause like bacteria to stay in the lungs and later on cause other progressive lung damage. So in recent years, there have been an increase in home-based treatment, which is necessary since um, patients with cystic fibrosis typically require daily self-care and regular checkups. But with these new technologies, um, patients can now have remote access and wearable devices that help monitor these treatments and their progress without actually having to go to the doctor every time to get a checkup. And this is especially valuable since it is hard for patients to have like regular checkups just to see how they're doing. Since these home-based monitors can help, we see a value in these cystic fibrosis technology. Whereas like in the past, usually more extensive treatments required more hospital visits, but that's changed since then.
So with increased technological capabilities, real-time tracking and data transmission to clinical teams has become more feasible. It offers a compelling context in which to investigate how home-based and wearable technologies might support cooperation and potentially redistribute care work between clinical teams and patients. So a European project called MySafeApp is currently trialing a clinic-linked self-management app and educational tools for cystic fibrosis patients to promote good nutrition and enzyme dosage. So whose primary aims are basically to implement more disease management activities and smartphone capabilities that cystic fibrosis patients are able to have access to at the comfort of their own home. Also improving communication with healthcare providers and cystic fibrosis patients, yet also facilitating that socialization of the patient and the cystic fibrosis community, just because they're not able to come in contact with one another because of their low immunity levels. They also have access to other technological innovations such as the AthleVest. That's basically a form of physical therapy that conducts high frequency chest wall escalations via a wearable jacket vest that they use to basically thin up and loosen up mucus that helps them clear up their airway.
As for the limitations in terms of what the study on cystic fibrosis offered, the findings were only considered to be theoretical, and they could not be considered generalizable to all cystic fibrosis patients or clinical teams in all cultural or healthcare contexts. However, what this study does is bring to light the value of trade-offs that can be considered when designing technology for chronic health conditions such as cystic fibrosis. The medical field, in terms of clinical settings, may benefit from the potential reduction in hospital visits should remote monitoring technology take care of the uncertainty of their necessity. This way, there's a balance between the amount of care work in multidisciplinary teams and patients who have already had to address the burden of living with chronic illnesses such as cystic fibrosis. Technology has to then be well integrated into their lives as well as those who monitor the devices in order to be properly and efficiently utilized to their full potential.
Article number 2 by Mike Miller talks about telehealth. Telehealth is essentially the use of digital information and communication technologies such as computers and mobile devices that are used in order to access healthcare services remotely or to manage healthcare. They may range from the technology you use in your own home to the technology that your doctor uses to improve your healthcare services. The concerns with telehealth range. Although quite practical, telehealth is not fully supported by patients or doctors. The most argued reason for this derives from this idea that patients have a preference for face-to-face interaction that 42% of health providers believe to be true. However, in reality, there are many other factors that contribute to this, which include the patient's distrust in technology, their lack of technological skill, lack of resources, and concern for the quality of healthcare provided by telehealth compared to that of human. These limiting factors and distrust in technology will eventually fade away as time goes on, as technology is becoming more prevalent and reliable as time goes on.
Aside from the readings, on Monday we had a guest speaker who came in and specialized in joining startups or just being an entrepreneur. He had experience in being part of a variety of different companies, whether it was health, data, or anything else. And the advice that he gave to those who were looking to be future entrepreneurs were to always continue and pursue what they were doing. The media and the public don't exactly show how much or the amount of research and the hard work that it takes to have a product become successful as a startup. And he puts an emphasis on making mock-ups and then studying the coding later. And this was similar to the hackathon in that my group made mock-ups in order to simulate the technology so they would become more straightforward to code. And in terms of health informatics, the technology is rapidly evolving as it's becoming more and more user integrated, and we need to keep in mind to have prototypes before spending any time and money in order to develop the software, much like the entrepreneurs who tested out their products.